next presenter we have is Rupinder Singh, and from a company called Cradle, and I'm looking forward to hearing from Rupinder because I want to learn a bit more about what Cradle does as well.
Thank you very much, Janice. Good afternoon, everyone. The name of our company is Cradle, and the name of our solution is Connect. I'm the Chief Strategy Officer and one of the co-founders at Cradle. So Cradle, the Connect system, is the only TV-based video calling and IoT wellbeing platform. So with Cradle, we decided to, rather than go the traditional route that many technology companies seem to follow, which is fit the person to the technology, we decided to fit the technology to the person. So use something that everybody is familiar with, and it doesn't create any anxiety, which is their own TV. So the Connect Hub sits on top of their existing TV at home. So the Connect Hub only needs to go on top of the person's TV at home. Everybody else in that person's network, we call a supporter. So that could be a son or daughter, a district nurse, a social care worker, or a charity. Everyone who is a supporter simply requires the Connect app on their phone, or they can access Connect via their web browser on their PC or laptop. So only the person at home needs the Connect Hub on top of their TV. So it's their existing TV that this goes on top of. And it connects via Wi-Fi, Ethernet, or if they don't have Wi-Fi, it has an integrated 4G port. So the problem that we're seeking to match this solution to is really a commonplace problem, which is social isolation, which is a growing, increasing concern, but also a very reactive healthcare system, which tends to deploy difficult and complex technology for older adults in particular, such as iPhones and iPads, which are small screens which don't help, but also require to be charged. So much of the feedback that we get from the NHS is when they try and call the user, the iPad or phone isn't charged. And lastly, when you get over a certain age, leathery fingers make it quite difficult to navigate small screens. So we're using a person's existing TV, which makes for a much better conversation and also a wellbeing platform. So in terms of the Connect system itself, the Connect Hub sits on top of the user's TV at home. It has an automatic privacy shutter, a motorized privacy shutter, which sits in front of the camera. So the only time the camera is ever exposed to the user at home is either when they're taking a video call or making one. This is really important for privacy, dignity, and also anxiety. In terms of the interface, it's just driven by a simple yes or no system. So there are no complex questions here. Make a video call. Would you like to access your photos? Would you like to watch a video? That sort of thing. And lastly, the Connect Remote, which is really the only thing that the user will ever interact with, mirrors the on-screen experience. So simple yes and no buttons that mirror the on-screen experience. So making everything simple and intuitive. The remote control itself has large buttons, so it's been designed with older adults in particular. And therefore, if you just tremor over the button, it wouldn't do anything. You have to actually go the travel distance. So in terms of the types of users which every deployment of Connect creates, firstly, you have the user at home. So the user at home simply uses their existing TV with the Connect Hub on top of it, and they interact with the Connect remote. Then you have care providers and also family and friends, and they make calls to the user at home or receive calls just on their normal devices, so they don't need a Connect Hub. And today we're servicing NHS trusts, councils, care providers, charities, domiciliary care providers, and others. Our system is also an IoT wellbeing platform. So as well as video calling through the TV, it also includes a range of different devices. Some are about wellbeing, some are about safety, and some are about health. So these are simple to use devices. None of them require any manual entry from the person at home. So for example, the pulse oximeter there would simply go onto the person's finger. It would automatically send the reading directly to the Connect dashboard for the carer to see. And it will chart those readings with the ability to set minimum and maximum thresholds so that you can see if the readings are outside of a particular normal range. We can integrate any third-party device with our platform so long as it has an open data protocol equivalent to an open API. There are 4 main use cases for Connect. First is loneliness and isolation. Second is healthcare. Then we have domiciliary care, and also centralized support type functions, which could be sheltered accommodation, retirement villages, and similar environments. Now, around these 4 bubbles, you can see a number of features. So some of these features are commonplace to all of these 4 areas, such as video calling, video upload, messages, reminders, photo upload. But some are more bespoke, such as healthcare and domiciliary care might rely on health IoT devices. Loneliness and isolation might rely on our feature around TV to TV calling. So if Betty has a Connect Hub on top of her TV and Margaret has one, they can call TV to TV. And next month, we're also releasing a feature which we call Broadcast, so the ability for one person to stream live to all of their Connect Hub users. And that could be live exercise, day center activities, you know, the local coffee club or book club, or even the Sunday church service. So it's about bringing community into people's homes. So that was a relatively quick run through of the system. And what I'd like to do is just quickly in the last minute or so, just share some of the experiences that we've had with our customers in the UK and also in Europe. So the system is very easy to use for all users, so there's no training required for anybody. In terms of the way it's being used in the NHS and social care, it's being used across pathways such as virtual ward, respiratory care, long-term condition management, reablement services. And care homes are increasingly using our system as well, where it might go into a communal area, or it may also go into the residence room itself for loneliness and isolation video calling with friends and family, which of course through the COVID pandemic has drawn quite a lot of attention. So I hope that was a easy enough to understand in terms of the system and the way it operates. If you have any technical questions around how the system operates, I can try and field those as well.
Rupinder, thank you very much. That's a really interesting presentation, and it's not something that I've seen before, but I know that I tried to teach my mum how to use an iPhone recently, and I completely get the whole thing about the distance of travel on the buttons, because it was one of those ones that had the haptics, and it just completely blew her mind, I think. So that's really interesting, and I can see lots of potential applications for your system.